Good afternoon and welcome to this webinar. My name is Mridul Ganesh. I'm the Chief Product Officer of Laudio, a transformational leadership platform for frontline leaders in healthcare. And it is an absolute pleasure to be joined here today by Sarah Magdon. Sarah, thanks so much for being here. Sarah is the Nursing Director for Inpatient MedSurg and Intensive Care, Nursing Education, and Care Management at the Central Vermont Medical Center. Prior to her current role, Sarah was the Nurse Manager for MedSurg for about 3 years, and prior to that was a practicing nurse in the Nurse Resource Pool and the Intensive Care Unit for 6 years. She has a bachelor's degree in nursing, as well as exercise science, has a certified nurse manager and leader certification from the American Organization of Nurse Leaders, and she's currently obtaining a master's degree in business administration. We've been talking to Sarah regularly in the process of building Laudio, and she has always been a never-ending source of tips, tricks, and insights into how nurse managers operate and how we can be making their incredibly complex and hard lives a little bit easier. In this conversation, we'll talk about burnout, we'll talk about engagement, and we'll specifically touch upon what nurse leaders can be doing to balance their existing hires when they're supporting and onboarding new hires. So Sarah, welcome. We're very excited to have you here today.
Thank you so much for having me today.
Excellent. So I know that burnout and engagement, they're topics that are on top of everyone's minds today. I wanted to start by talking about new hires. Summertime, many hospitals are probably onboarding or soon going to be onboarding new cohorts of nurses. So in your mind, in your opinion, if you were to think about the top drivers or the top factors that influence engagement and burnout for new hires, what would they be?
I'd say the first one that comes to mind is, without a doubt, the presence of the nurse leader. The visibility, the transparency, and the trusting relationship that is built with the nurse leader in that department where that new grad has come. There needs to be a foundation of support there. And our new grads that come in are really, they're reeling from nursing school. They don't know which way is up. They're trying to figure out, do they know that I could kill someone? And it feels that way for about the first 6 months for most new grads. And so it's really important that they have a net that catches them, makes them feel safe, that they're supported in their new role, and that their team, the existing staff, that greets them and welcomes them with open arms.
Excellent. So that's a super point, Sarah. One of the things I was curious about, and I'd love to get your thoughts on, is do you see engagement and burnout as two separate problems? Do you see them as, a common theme with a similar root that you need to solve for? How do you exactly think about these two problems?
They're very much related. If nurses are not engaged, then they're more likely to burn out. And so part of the way that we can prevent burnout is to increase the engagement that we have with our staff. What that looks like is really, they expect our nurse leadership team to be shoulder to shoulder with them. And that's really hard to do when you have a lot of other pressing responsibilities. And so it's really important to set up a leadership structure that supports that. The engagement factor is really about letting them know that their voice is heard and finding a way to show them that. And there's lots of different ways to do that I can share with you. The biggest thing that I did when I started in my management role to let people know that their voice mattered was that I carried around a notebook with me wherever I went, and when someone said something to me, I wrote it down. And I wrote their name next to it, and I put a little box there, and I said, see, I'll come back to you, and then I'll check the box. And they knew that. They began to trust that it might be 3 weeks before Sarah comes back, but she's going to come back because she wrote it down, and there's a box in there that she needs to check when that task is done or when that follow-up has been completed. And so even though I was overwhelmed and my to-do list was 4 weeks long, my team knew that I was there and that I had their back and that I would come back to them with that follow-up piece. And that was the first thing that I did to really build the trust of my team as a new leader.
It's incredible. And how did you manage to do that with a team of 100 people? Like, how is it even possible to follow up and
That's probably why my list got to be 4 weeks, 4 weeks long. It was really hard, and I put in a lot of extra hours and time, and it took me a little while to figure out how to build the team so that it was less about all of me and more about a team of leaders that supported this MedSurg team of 100 people. So at the time I was a nurse manager, and I had these clinical nurse coordinators that were working in the charge nurse role. And in our hospital, a clinical nurse coordinator is a member of the leadership team. They perform evaluations. They're a resource for the other nurses and LNAs on the floor. But they were stuck at the charge desk. And we were looking at our team, which suddenly the number of new grads that we have went from 20% to 60%,
right.
because that's what's there. And so we had to really think strategically about how are we going to support these new grads without necessarily changing our ratios. What can we do to make it safe? Because they didn't feel safe when they look around and like, I'm the most experienced one here and I've been here a year.
Right.
So what we did was we figured out how to take those clinical nurse coordinators out of the charge nurse role, and we put them into a resource support role. We initially considered educators, and then we're not going to find an educator that wants to work 8-hour night shifts or 12-hour night shifts, and so it didn't make any sense. There wasn't a market for that. Educators become educators most often to have mostly day shift hours, and that's not the primary driver, but it was going to be challenging for us to fill that role. And we looked and we said, wait, we've got the experts here, they're just not in the right seat on the bus, so we've got to get them in the driver's seat. And so we pulled them off of that charge nurse role, we put them in the resource position, we really recreated that clinical nurse coordinator position to where now the CNCs are out on the unit with our new staff. You've never done blood before? Great, I'm going to show you how to do it. Let's pull the policy, we'll look at it together, we'll practice, talk our way through it, and then go in the room with the patient. I'm right with you the whole time. You've never done an NG tube before? Same thing, we're going to walk through that. Got a challenging family scenario? Great, I'm going to go in there and help you with that. And so it really helps to build the skill set of the team because the CNCs are role modeling shoulder to shoulder with the rest of the nursing team, and kind of building that skill set and their confidence. So that was huge, a huge way that we leapt from being completely overwhelmed by the number of new grads that we had to feeling a sense of we've got this. We do this all the time, and we're okay. We've got a system that's safe. The other thing that we did was to build an official new grad program, and so our educator team and our leadership teams came together to do that and built a 3-month internship program and up to 6 months in our specialty areas of orientation. One-on-one, and so that's been really successful for us. There's a cohort of new grads that all come in together, usually, like you said, coming up this time of year in July, and those new grads, they have, in addition to their normal precepted time on the units, they've got didactic sessions with our nurse educator team or our nurse manager team, going through things that are not necessarily clinical things. It's how do you have that difficult conversation with that doctor? How do you address this family scenario that happened? What do you do when you lose your first patient, when your first death happens? Those are not things that you're usually prepared for when you come out of nursing school. So we really try hard to prepare our new grads through those didactic sessions in the new grad program. We even have them, maybe it's not their favorite thing, but we have them journal every week. And one of our nurse managers sort of reviews those journal entries and says, hey, can I talk to you about this one? I think I can give you some tips or support. Or,
that's incredible.
Or, hey, is it okay if I pass this information on to your nurse leader to let them know that maybe they could give you some support in this area? So it might not be their favorite activity, but it definitely has proven valuable for us to give them support in other ways.
I can imagine. And is that the new grad's own manager who reviews the journal, or is it someone else? Have you set up some kind of structure that enables you to run a program like this? What exactly
Yes,
do you do?
It's a separate manager at times, so it depends on the department where they're hired. The last time we ran the new grad program, it was actually the manager of our nurse resource department that was facilitating the program, and so she was meeting with new grads weekly and then bi-weekly throughout the first 3 months of their program, to review journal entries and just do coaching sessions, check-ins, and support, and they were not reporting to her in any way. So it was sort of a nice way for them to have an additional layer past the unit leadership that they work with, a safety net, and then she would then relay back to the leader of that unit, hey, this nurse is struggling a little bit, and she said it was okay for me to let you know these are the areas where she's looking for some help, and then they can meet with that nurse and provide her with additional support. So it's been a nice layer to have there, an additional mentoring, if you will.
That's incredible. And I'd love to come back to these topics of team construction, of having the right programs in place, having the right preceptors in place. One of the things I was curious about is you clearly believe in the importance and the value of leadership and the role that they play when it comes to engagement and burnout for new hires. My question to you would be, are there any instances that you can draw upon in your own experiences as a nurse where you can start shedding light upon this relationship between your own engagement, your own burnout, and the interactions that you had with leadership?
Absolutely. I was really fortunate when I entered the nursing profession that I came in through the new grad program that was in place at the hospital where I'm at now. And I've been kind of homegrown in this facility from a new grad to a director, which is incredible. It's been a great experience. During that time, the things that really shaped how I am now was the experience of being on night shift. I worked on night shift for 6 years, and I remember the mindset of the night shift nurse. Like, where are these nurse leaders? I hear there's a bunch of them, but I don't see them anywhere. And as a nurse leader, I now understand the flip side of that I'm putting in a lot of hours on the days, and I have a home that I need to go to occasionally, and I can't be here at work with you two at night. And so trying to find that balance. I knew as a night shift nurse that if I was going to be in leadership, that I would want to find a way to be present for my night shift team. And I was really determined. And I remember saying, you guys, I'm going to change my schedule. I'm going to work at least one night shift a month. That didn't happen. And I was blown away that I couldn't do it. I was really disappointed in myself that, wow, I was really judgmental of the other nurse leaders that I've had as a bedside nurse that were not present, and I thought I could do it, and then I couldn't do it either. And I was like, why is it so hard? And so I continued to try to find ways to do that. And what I realized was night shift isn't really asking for all that much. They're not looking for you to be there another 20 hours of the week with them. They just want to know that you're available. And so I really worked hard to try to work that relationship with them to figure out what was visibility to them. What was it they were looking for? What was meaningful? And I did a lot of feeling circles around that. I would just come in and sit down, hey guys, can we talk about this? Because I'm trying to figure it out. I feel like I'm not doing a great job of being here for you, but it's my goal. And so that was another big part too, is being a little bit humble and a little bit vulnerable. I'm really not sure that I'm doing a great job, and I need your help to know that. And so that set the stage really early for being receptive to feedback, and that they knew that they could approach me with that kind of feedback. And that was really important to me because I had seen both kinds of leaders.
And how did you end up, so there are two follow-up questions here. One is, how did you end up solving that problem, right? Bridging that gap between yourself and your night shift nurses. And then the second is, you used the term feeling circle. Could you describe that a bit? What exactly is it? What is the process? And I'm sure the audience would love to know more about it.
We do a lot of feeling circles. I don't know that it's everyone's favorite thing, and I think it's something that I've brought to our teams that has had a positive impact. So a feeling circle is just a really casual circle where I walk into the change of shift huddle and I'll say, hey guys, I heard a rumor on the street today. Probably wouldn't make you feel very good. Can we talk about it? And it might just be, we heard that this person is leaving, or we heard that this new staffing model is coming. And one, I can kind of confirm or deny the rumor, but two, I can get a sense of how people are feeling about it. And I'll kind of go around and say, Mridul, how do you feel about it? And how do you feel about it? How do you feel about it? And everybody gets the chance to hear how each other's feeling, and then they feel heard by me in the long run. And I can, again, kind of validate their feelings. I can give them, once the feelings are there, I can add some facts to the feelings party, because you can't bring facts in without expressing the feelings first. And so the feeling circle has been a big deal. I mean, we've now implemented that further down into our nurse leader rounding. And so we can talk about that a little bit more as well.
Of course. And so one of the things, at least I've seen, is that it is hard to get people to express their true feelings. Are there specific questions you would ask, or is there, what makes people feel comfortable enough or vulnerable enough to say that this is how I'm feeling about a certain topic? Are there any specific techniques, specific language that you use to do that? I
do use some different techniques. I think the first one is just having the relationship in the first place. Like I said, establishing the trust that people know that you can receive feedback without personalizing it or becoming defensive. So really nailing down that skill of receiving feedback is important for a nurse leader. Because 9 out of 10 times it's not about you. It's about the scenario that they're in, or something that they don't understand or that wasn't well communicated. And so it's important to remember it's not about you. The other piece is I really lean into the nonverbal body language that I see, and I call them out when it doesn't match the words that they're saying. And so I use that technique, whether it's in a big feeling circle or if I'm mediating a session between two employees. When I see this, somebody like, I'm fine. I will say, well, you know, your face is saying one thing, but your body's saying another, and I kind of feel like they're not matching, and it doesn't feel fine.
Okay.
And sometimes that, just calling somebody out on the fact that your words don't match the rest of you, creates a little moment of vulnerability that I have an in to see if I can dig in a little bit more to see what they're really feeling. Or I might just go the route of empathy and suggest, well, I can only imagine that if I was in your scenario that I would feel this way.
Oh,
and once they know that it's okay for me to feel that way, then it opens it up like, well, yeah, you're right, I do feel that way, and I am angry, or whatever that feeling is that they have. I've kind of opened it up by expressing, I would probably feel that way too.
Incredible.
Yeah.
Incredible. And to go back to the question of, you know, your night shift, how did you end up, you know, dealing with that question? There
was a couple of techniques that I launched as a nurse manager. Some I stick with now, some I've, you know, had to move away from as I've kind of gained more departments under my belt. But one of the big things was that I figured out a time that worked for me in my life that I could consistently be there during the night shift. And for me, it was every other Friday at 4 a.m. And that just happened to work for me. My husband has Fridays off. It's going to be different for everybody.
Right.
But for me on Fridays, I knew that I could go in there and spend from 4 a.m. until the night shift ended when they left at 7:30. That was all for them.
Right.
And I would go out and sit in the nurse's station, and after I had some repetition to it and there was a pattern, people realized, oh, it's Sarah's Friday, and they would kind of flock around me, and next thing I knew there was a circle of people and we were having feeling circles. So that sort of happened somewhat organically, but it was also a really great opportunity for me to look ahead at the next weekend. And I could say, I took that time to look at their schedules with them, because scheduling for night shift is really tricky. They're sleeping when you want to talk to them about their schedules.
Right.
And they're sleeping when you're like, hey, can you work next Thursday? So it really made a big difference for them and for me that I was there at that time to say, hey, next weekend, are you able to switch from Friday to Saturday? Or looking a few weeks ahead, can I move you from here to there? And they got less phone calls about it while they were sleeping, and I had to then make fewer phone calls because I addressed it right there. And I often had the following week fixed for night shift just from coming in on that Friday.
Oh, that's incredible.
So it was a scheduling tool for me as well. It was a double edge, but they definitely saw the value in having a reliable, it was a sign that she cares, she's trying, it matters that she sees us. And they knew they got to recognize, like, it's Sarah's Friday. And sometimes I'd bring coffee with me, sometimes donuts, sometimes a little treat, but other times I just show up looking ragged and sleepy, and they were okay with that. You know, they knew that I was trying. And so that meant a lot, I think. The other thing that we did was we shifted our staff meeting times. We surveyed the team and said, what works? And initially we were doing 3 staff meetings a month, all with the same content, repeating the time. You know, it was a noon, a 5:30 at night, a 7:30 in the morning. And night shift said, is there really no way you can do this while we're here? Because it's a lot for us to stay the extra hour late or come in the extra hour early or come in on our day off. And so we worked with our clinical nurse coordinators that are on the night shift and said, do you guys feel like you could share this staff meeting content for nights? Yeah. Super easy. So the nurse manager kind of buddies up with our CNC team, makes sure that they know the content for the staff meeting that they then share to the night shift during that little lull that they sometimes have in the wee hours of the morning. It was a huge satisfier. They're informed and they don't have to stay for the other during the daytime. And so they felt really heard when we did that. That was a shift that they had requested, and they're like, yes, thank you. Like, you heard us and you did that. So that was a big change that helped our communication with them as well.
Incredible.
One of my favorite things recently that I did for Nurses Week, actually, because we just had Nurses Week, which is a big fanfare at our hospital. Every day there's events, but this time we tried something a little different. I used to be a barista, so I used to work in coffee shops back before I was a nurse, and everybody loves coffee in nursing for the most part. So I set up a barista cart on a stretcher, and I put a sheet over the stretcher, and I got iced coffees and caramel syrup and chocolate syrup and vanilla syrup and whipped cream and all, like, soy milk, almond milk, whole milk, skim milk. And so they had choices, you know. So I went around to every unit with my barista cart and made them mixed iced coffee drinks.
That's
at the beginning of the night shift, and they were overjoyed. They were like just overjoyed. They were like, this is the coolest thing. So I had so much fun. And what was really neat about it is that sometimes when we don't see the night shift as much, there's a little bit of awkwardness there when we show up, when they're like, ooh, are you here because somebody did something wrong, or there's something bad that's happened, or Joint Commission's coming, or something that's bad. You know, they're not expecting to see us as often when it's just for something good. And that's something we need to address that. You know, we kind of have to break through that barrier if that precedent has been set, that they only come when it's bad. And one way that I found to deal with that is this coffee cart was such a light approach. It wasn't like, I'm here to talk to you. You know, it wasn't an awkward, how are you doing? Good to see you. It's been a while. Forgot your name. You know, all of those things. Instead, it was, hey guys, I'd love to make you a coffee drink. And then they stood there and they chatted with me and how's the kids and the vacation and it was really nice. It was a low pressure way to get in there and visible. Folks were able to ask questions if they had them, but they didn't feel like they had to. And they didn't feel like they had to be work chatter if they didn't want it, because there was a casual setup with the coffee bar. So I really enjoyed that. And I talked to our nurse managers about, let's do this once a month, because this was really fun and really inexpensive. It was like $50.
Awesome.
Yeah.
That's incredible. So it seems like consistency, making sure they're heard, and lots of treats.
Yes, well, everybody loves food. Nurses love food, but what I've heard is that they get tired of pizza. And so you got to mix it up a little bit. You got to mix it up, let them do the barista bar instead.
Incredible, incredible. And I'm guessing play to your strengths, right? Play to your talents.
That's right.
Whatever way you can do to soften that relationship up. That's incredible. Great stories. The other thing that has always been fascinating to me, which I know is a slight diversion, but your approach to surveys. I remember when we talked about this, I've heard from so many people complaining that, hey, when we send surveys out, people are over-surveyed and, you know, we get like a 20% response to them. I know you have a unique approach to surveys. Would you like to share that at all?
Well, in terms of surveys, it's really about trying to hear the voice of your team. And so there's a few different ways that we do that to hear the voice. We do use the typical survey method, but we'll usually attach some incentive to it. Like, so complete this survey and you'll be entered to win a drawing for something cool. But the other way that I hear the voice of my team is to use a giant Post-it note that I put on the wall in the break room. And I write at the top, what's bugging you? And it's a loaded question for sure. I put 2 columns on there, the problem and the solution. And my ask to them is that they're professional and that they can suggest a solution for whatever the problem is. And I go in there once a week, I pull down the what's bugging you, and I type it up and send it out in a stoplight tool. And so our nursing team sees these are the things that we've been working on. So Sarah's heard us. I've gotten the feedback. These are the things that are in progress on how I'm trying to address it. And so the what's bugging you, I use that tool as a nurse manager, and it was really effective to get the low-hanging fruit, the things that just irritate them on the daily basis. Like, why don't we have enough oximeters? Or why is the sharps container so far away from the door? And those were easy ones to fix. And so the what's bugging you was a really nice way as a newer nurse leader to hear the voice and be able to communicate back when I was feeling really overwhelmed. It helped me stay organized too. To have that red, yellow, green stoplight tool that they could see where I was in the progress of working on it.
Oh, fascinating. Absolutely fascinating. So if I wanted to talk a little bit about leadership support, right? And that can mean many different things to different people, I can imagine. So in your experience, when you try to compare and contrast the needs and the expectations of, say, someone you hired today, are they different? You know, how would you compare and contrast their needs, the needs of people today versus someone you hired, say, 3 to 5 years ago?
Great question. It's so important to remember to have some energy put into your backbone of your unit. Those folks that have been there from the 3-year mark to the 35-year mark, those are your lifers. Those folks are there for the long haul, and they often kind of fall by the wayside because they don't need your help. They're not the squeaky wheel, so to speak. Your squeaky wheels are the ones that are struggling, and those folks that have made it to, past the 3-year mark are usually not struggling in terms of years of service at your facility. You would have weeded them out already as a low performer before that point. So in terms of years of service versus years of experience, I would say years of service wise, the ones that have been there past that 3-year mark, they need to know that you see them.
Right.
They need to know that you know that they're the backbone
Right.
of the unit. And there's got to be some plan for recognition there, so that they feel like the newbies aren't getting all the attention.
Right.
A lot of facilities we've had to use sign-on bonuses, relocation bonuses. There's all these robust orientation programs.
Right.
That maybe weren't available when those other folks came into the facility.
Right.
And so they're going, wait a minute, I'm the one that's training all these people that get all these incentives. What do I get?
Right.
And so trying to ensure that you've got some focus on that recognition of that team, or that part of your team, really ensures the retention piece. We've really looked at, we've brought a lot of that to our Nurse Management and Operations Council in our hospital. It's part of our shared governance structure. The management and operations tools, working with our chief nursing officer to look at, here's the budget that you have for next year for market increases, and could we use some of that budget for a preceptor differential,
Right.
or to increase our charge nurse differential.
Right.
So we're really including the bedside nurses in making the decisions about how we recognize folks that have been there that long.
Right.
How do we recognize the ones that stay?
Right.
We've also asked our human resources team to help us with stay interviews. We found that those are more effective than exit interviews. Exit interviews, they're already gone. And the ones that answer exit interviews are the ones that are unhappy usually. You don't ever hear anything good
Right.
from that about what you're doing well. In a stay interview, you can capture, why are you here, why do you stay, and why might you consider leaving?
Right.
And it allows you to kind of fix those things before they leave, instead of after the fact.
And how often would you do something like a stay interview? Is that something you do every 6 months with a person, or is that?
You know, it's pretty
frequency?
new for our facility. So we don't have a baseline that I could offer you yet, but I would say, to me, it would be a great thing to do on an annual basis at least. And it's nice that in our hospital, human resources is able to come in and help us with that. So if that nurse is not ready to share that information with their direct leadership, and they need a little bit of coaching on how to get there, then HR helps them with that and maybe helps prepare them for that bigger conversation with their nurse leader if there needs to be one.
So one of the things I wanted to touch upon was this idea of social integration. And in your experience, how important is it for a new hire to be socially integrated into the unit when it comes to factors like engagement and burnout? And do you do anything specific about that?
Absolutely. So it's when you're a new hire, a new employee, and you're working full time, it's like a second family at work. You see them more often than you see your family at home during your waking hours. So it really is important to make sure that they feel like they're part of that family and part of that team. A couple of things that we've done. We developed a spirit council on our MedSurg unit, which tends to have the highest turnover. It's turbulence. They're feeding the rest of the hospital with MedSurg nurses, and then MedSurg is taking in the new grads. Right. So what we've done is the spirit council plans the activities that knit people together. And they're a group of nurses and LNAs from MedSurg and from our resource pool, and they plan the baby showers and the bridal showers and the birthday parties and the Taco Tuesday and the National Annual MedSurg Pumpkin Spice Day, which is not national, but it is now annual. So there's always something fun going on. They do quarterly raffle baskets to fund their activities. So
Right.
there's a self-funded, they opened an account in the credit union and sort of fund their own activities, and there's nobody from our leadership team on that committee. It's very much homegrown, very organic. They just really like to have fun at work, and they spread that joy to everybody around them. Sometimes they'll come to me and say, hey, we have an idea, but we need a little funding or a little support from you, and I'm always all in as long as I can afford it from the unit budget, because they've had some really great ideas. Like, we want to recognize each other and be able to say, hey, thanks for your help, that was really awesome. So they asked me if we could put $3 meal cards out at the charge nurse desk that they could say, hey, I really appreciated your help today. I want to give you this meal card. And I was like, yeah, that's a great idea. Let's do it. The other thing that we did was we have kind of a welcome board. So when there's new hires that are coming in our break room, our nurse educator will put their pictures and a little soft bio about them up on the board so that people can see, like, oh, she likes snowboarding. I like snowboarding too. And oh, they like skiing, and that's my jam. Oh, they're a dog person. And we make connections on the unit that way. And then those pictures end up in a binder all together so that you can kind of flip through and see the whole unit. So as a new hire, you could sit there with the book and say, oh, there's 4 people that like knitting, just like me. And so it's a really nice way for them to make those connections that are not necessarily about work.
Yeah.
But when you play hard together, you work hard together.
That's incredible. And how do you deal with the work of maintaining something like that? Is there someone, like, do you do that as a manager, or is there someone else who's tasked to do that?
The Spirit Council is really responsible for most of that, and our nurse educator plays a big part in that because she collects that information from them during orientation week. She posts it on the board and sort of follows through as part of their orientation process.
Okay.
So it's just one of the check boxes on the orientation list. Did you fill out your bio and get your picture on the board?
Right.
Yeah.
Great. So the next thing that I'd really like to talk about is building the right leadership team when it comes to creating the perfect experience for your new hires. Would you be able to talk a little bit about your experience there, what you've seen, what you've experienced as a health system?
Absolutely. We've put a lot of effort into making sure that our leadership team is the right leadership team and that they're prepared. And so what we've done is we've built an orientation checklist for each level of leadership. We've got time where we come together as a leadership team with our chief nursing officer, our directors, our managers. We come together weekly, monthly, bi-monthly for different reasons with different levels of leadership and offer education sessions about financing, about giving crucial feedback, having crucial conversations, coaching, mentoring. Those are all really important topics to cover with our new managers. We've had guest speakers come in and cover generational differences.
Right.
It's really important to recognize that new hires coming in, the generation of new hires that we're getting right now, they know that they're a hot commodity. They know that they're in high demand. They know that there's a nursing shortage, and they know that they have options.
Right.
They know that they've got choices, and so their expectation is really that you come to them and offer them enrichment, that you're offering them leadership, that you're offering them growth and development opportunities. They don't expect that they have to come to you.
Right.
When really what we're used to is the teams that we've been working with for years. They're kind of used to, if I need something, I'll let you know. Don't come to me, I'll come to you.
Right.
And so that's been a shift in the workforce that we see, is that they really expect our nurse leaders to lean in and be present and anticipate their needs and look at them as individuals and grow them as individuals. And in order to do that as a nurse leader, you have to have a big toolkit in place.
Right.
And so one of the biggest things I think that helps our nurse leadership team is we have a management boot camp at our facility, and they learn about how do you communicate with big teams? How do you deliver feedback?
Right.
How do you have a crucial conversation?
Yeah.
What do you do when there's a policy violation and you need to do a corrective action? Those are not things that we learn in nursing school. We oftentimes will look and say, oh, they're a really good nurse, so let's see if we'll put them in the leadership role. See, what do you do there? And so we need to really support that transition.
Yeah.
And having been through that transition, I feel really comfortable saying it's tough.
Right.
I went from the bedside to a manager to a director, and been really, like I said, kind of grown on the job. And having those resources in place was key.
Yeah.
Having a facility that was willing to have their CNO right there at the head of the table with the directors and the managers and the CNCs and the supervisors and the educators on a monthly basis to make sure they understand the strategic direction of the nursing team as a whole makes a big difference to cut down silos, to standardize the way that leaders approach all of the nursing teams in the facility. It makes us a really cohesive unit. And providing education to them ensures that we're also warming the bench and getting ready for the next level, which is essential when you're running a facility. We've always got to be looking for the next thing.
Excellent. And from a very tactical perspective, it's obviously really hard to manage a team of 100 people as a single manager. And when you have a larger leadership team, say 3 or 4 people who are managing the same team, we've heard that collaboration can sometimes be an issue, making sure that everyone's on the same page, everyone has the same information. Is that a challenge that you all have felt? Is that something that resonates with you? And how are some of the ways you have dealt with it?
Absolutely. It's so hard to have, so for our manager, or for our MedSurg team alone, there's a director, a manager, an educator, and 4 CNCs, plus our relief charge nurses. It is so hard to make sure that we're all on the same page and communicating. And we've tried a bunch of different methods, from roaming text, group text messages to group email alerts and updates. We've got massive spreadsheets of data on every employee so we can track, do they have their ACLS? Do they do telemetry? Or do they have their IV certification? Trying to make sure that each one of us has all of that information is a huge challenge. And especially when it comes to the disciplinary side or the accountability side, to try to make sure that that I had that conversation earlier today, when it's sitting on a piece of paper in a folder in the office, is a big challenge. So the timely communication of that still challenges our team because it's a big team. And we have a lot of tools that we use, like I said, spreadsheets, emails, text messages, but it still feels discombobulated at times, for sure.
Incredible. So shifting gears a little bit, we've talked a lot about new hires. If we move to your existing staff, and as we can imagine, when you have a huge influx of new hires into your unit, there are many stresses and pressures that your existing staff can feel. What would you describe as some of the biggest pressures that they feel?
For the existing team that's there, they are precepting every new hire that comes in the door. And oftentimes, we see a fair amount of turnover on MedSurg right around that 1.5 to 2 year mark. They think, I've learned everything I'm going to learn here, and I'm going to go to the ICU, or I'm going to go to the emergency department. So the ones that stay, they are your backbone. And their pressure is that they've constantly got a new team. They're constantly orienting their the next person. And they are looked at on the floor as that unofficial leader. They're oftentimes going, oh boy, I'm the only one here with more than 2 years of experience. So it's very challenging for them. It's a lot of pressure. They feel like they have to hold the safety line. They're much more vigilant than the new hires that come in. Our new hires often have kind of tunnel vision, check the box, do the task. Our more seasoned nurses are able to see beyond their own tasks and beyond their own workload, and because they do, and they see the potential safety issues going on around them with the newer nursing team. And it's a lot of pressure for them to kind of keep that bar up and make sure that everybody's safe and supported.
Right. And what are some of the ways you have tried to deal with that? What have been the most effective tools from your perspective in order to really help your existing staff through that process?
I think the thing that they appreciated the most was when we implemented the relief charge nurse differential. The charge nurse has a lot of responsibility, and so for them to feel like a little bit of recognition goes a long way. We're currently looking at implementing a preceptor differential through our Management and Operations Council. But beyond that, I think it's really important to set up one-on-one time with that part of your team, with members of your leadership team. Have check-ins, make sure that they know that they're heard and their opinion matters. They know that even though I'm not the squeaky wheel, I still get some grease sometimes. And one way that we do that to hear their voice is through shared governance in our facility. We've got a really robust unit council system. So we've got multiple councils that have representation from every unit in the hospital. And we were really struggling with engagement on our MedSurg unit in that council structure. And so our nurse manager had this great idea, what she calls the RAT pack, the Rapid Action Team, the RAT. Instead of trying to pull together a consistent group of 10 people that make up a council every month at the same time for a standard meeting, which we weren't having any luck. It was just the leadership team sitting in the room by themselves with no one else. So it was like, okay, this is the same meeting that we have every month with the leadership team. So we decided to try something different, have these rapid action teams where we say, this is the issue at hand, who wants to work on this, and what time is good for you? And that was big for, I think we've seen a lot more interest, a lot more engagement with that technique, because I'm interested in working on this one project, but I don't necessarily have the energy to do all of these things.
Understood. So rather than having like a false committee, you're like, this is a specific problem that we're dealing with right now. Who's interested in working on it?
Correct.
Okay.
Correct.
That is fascinating. And you also talked about recognition, monetary recognition, right? Having a charge nurse differential, having a preceptor differential.
Correct.
What role does non-monetary recognition play?
Non-monetary recognition sometimes has more value than monetary recognition, especially when it's done with intent and with authenticity. And I think those are the key features of it. It can't be just like a drive-by, oh, hey, thanks, you were great.
Right.
It has to be, I sought you out,
Yeah.
and to just to tell you that you're wonderful.
Okay.
And it might look like a thank you card that you send in the mail. It might look like I slipped a little $3 meal card into your locker because I knew you worked extra. It might look like gosh, there's so many other ways to recognize folks, but most often the thing that's really meaningful is that you're face-to-face saying the words with authenticity. Just, thank you, I really appreciate what you did. And being specific about what you're thankful for. Not just a general thank you, but what was the thing that they did that was awesome. And when you write that down on a thank you card and mail it to their house, you just kicked it up about 10 times.
Interesting.
Yeah.
And is there a difference between, say, some of the larger recognition programs, say, DAISY is an example, the larger recognition events
Yes.
versus the more drip regular recognition? Have you, in your experience, seen one to be more impactful than the other? Are they just completely different things that we should be thinking about?
I think that we need both. And the reason I feel that way is that if you only do it once a year or twice a year, people forget in between, and they only feel it at that moment that you did it. Those are really important too, though, those big recognition events. For Nurses Week at our facility this year, we had all of our nursing teams vote on who is the rising star LNA, who is the rising star nurse, who's the nurse leader this year that you want to recognize. And that was really cool. We had a lot of voting, and they had a nice certificate signed by our CNO, and we recognized them at a mocktail party in the lobby of our hospital with balloons and fancy hors d'oeuvres. And it was really well attended, and I think that kind of recognition where you were voted amongst your peers to be recognized has really some merit to it. To be recognized by your team is sometimes more powerful than being recognized by your nurse leader even. So that was really fun for us this year. We also have something called the Rose Black Award, which was an award that is funded by a family that lives in our area, a family that they were patients and physicians and nurses at our facility. And so there's a beautiful family that has funded a yearly recognition event for a nurse and an LNA from the hospital, our group practices, and our long-term care facility. And so 6 nurses and LNAs were recognized at that event, and they get this beautiful plaque, or glass plate actually, engraved with their name and some flowers and a nice speech, and it's a really nice event. People bring their families to see them be recognized for that. We do the DAISY every month. The DAISY program is great. We started doing the DAISY about a year and a half ago or so, and so if you're not familiar with that, I highly recommend the DAISY. But the things that we do in between those big recognition events, we have an acknowledgement board on our department. And so people can go and kind of write a little note to say, this person was awesome today. I really appreciated working with them. And then I would go once a month at the staff meetings and just pick 2 cards at random and give the giver and receiver each a gift card for $25 a piece, just saying thanks for saying thank you. Thanks for recognizing your team.
Interesting.
Yeah.
And does that motivate people to actually use the acknowledgement board a bit more?
Absolutely. And I mean, once they realize that if I recognize someone for what they did, I also could be recognized with a cash award. That was really great. And so the board is full. And then patients started adding to it.
That's incredible.
Because it's where they can see it. It's right in the hallway of our main nursing, right on the main nursing floor. And so when patients walk by, there's dry erase markers, and they'll often write little notes and say, thank you for this, and you guys are awesome, and I love you the most. So it's been really nice to be able to walk by and see that it's a big pop of color in the hall. Lots of fun comments on there. So that's been a win for sure.
So just zooming out, Sarah, I think this entire period of having new hires on your unit is one example of a change of a stressor on your unit. And as I'm sure we all are very aware of, healthcare is changing constantly, and nursing units change constantly. There are many, many stressors and changes that units need to go through. And nurse leaders, nurse managers specifically, are expected to guide their units through these changes. What advice would you have for health systems on what they could be doing to really prepare their nurse managers, their nurse leaders, to really guide their units through different stressors and different changes that the units may go through?
There's a lot of opportunities out there around change management programs. Our hospital has been providing education on the ADKAR method. They purchased a book about ADKAR for every nurse leader in the facility, and they sent a few, not just the nurse leaders even, but all of the leadership in the facility. We all received a book on ADKAR, and there were super users sent to training for change management. Mm-hmm. And they're providing snippets of change management education in our all hospital leadership meetings on a monthly basis. So that's kind of one piece of it. The other piece is to really allow them to be really well informed so that they know how to answer the questions. Mm-hmm. And so when we meet monthly with our chief nursing officer, the first half hour of that meeting is rumor control. Mm-hmm. What have you guys heard? I can prove it or deny it. Mm-hmm. I can confirm or deny that that rumor on the street is true today. Yeah. And that allows folks to go forward being really well informed. Mm-hmm. We also work with our marketing department, mm-hmm. and they help us to communicate things better to our teams. And mm-hmm. so they summarize that leadership meeting monthly and send us PowerPoint slides that mm-hmm. then we can use in our staff meetings. Okay. So I don't have to recreate that information. I've got it from them. Mm-hmm. We also use, we put big screen TVs in every one of our break rooms, not for Netflix, but for putting our slideshow content on. So there's slides that are going in there continuously with information that people need to know about what's happening on the unit. So when they're in there having their lunch break or whatever break they're on, that information is scrolling on the screen continuously for them to be aware of the latest and the greatest news that they've got. Mm-hmm. We're also a big fan of making sure that they're using a variety of communication methods. Mm-hmm. My personal favorite is the pottygram. Mm-hmm. Where you put the poster in the bathroom because they only have 5 minutes to sit down in a shift, and that's where it is.
That's awesome.
Yeah, so it's a very effective tool for communication on nursing use, but I would recommend laminating it.
So to wind up, Sarah, I think the last thing that I'd just love to ask you, we've covered a whole range of topics in this conversation, and it's been incredible fun. Are there any other tools in your nurse leader toolkit or in your experience as a nurse manager that you have found particularly effective while dealing with your staff from an engagement, from a burnout perspective, that you would like to share with the audience?
The last thing I think I would advise is to implement leadership rounding for both employees and patients. Mm-hmm. And so what that looks like is that your nurse leadership team, from director, manager, CNCs, they go out with a certain set of questions, an intentional set of questions, and check in with each employee on your unit and ask those questions. And the value of that is that if there's a story that people are telling themselves, for example, we are constantly short-staffed. I hear that a lot. We're constantly short-staffed. We're always short-staffed. You have the ability to change that story by saying, how's staffing today? Oh, we seem to have everyone we need. Oh, great. I'll check in with you again tomorrow. And you come back tomorrow. Hey, how's staffing today? Oh, we seem to be well staffed. Well, great, that's 2 days in a row. Oh, we're on a roll. And so you can kind of build that story and really reframe it to them to where you can say, hey, boy, the last, 10 out of the last 12 times I've asked you about staffing, we've been great. I guess it's not always bad. Yeah. And you can really reframe the story that people are telling themselves. Mm-hmm. And you also have an in on, is there equipment that you're missing today that you need to do your job? Mm-hmm. That's a question that I think is really important because it's hard enough to be a nurse. So to not have the equipment that you need makes it even harder. Yeah. So you can kind of tailor the questions to be whatever it is that you're working on in that moment. Mm-hmm. The first one is usually, is now a good time? Mm-hmm. So that you're not barging into somebody in the middle of their workflow. Mm-hmm. But it just takes a few minutes, maybe 2 minutes with each person to get a sense of where they're at in their shift. Can I ask you a few questions? Mm-hmm. And then you have the ability to trend that information and share it back. Mm-hmm. So our team funnels it all up to our nurse manager, and she extracts data and shares the trends out once a week with the team. Hey guys, we did rounds this week and this is what was said. Mm-hmm. For our night shift team, their preference and what works really well for them has been to do that as a feeling circle. So instead of the nurse leader going around to each person, everybody kind of gathers around the nurse leader and they have a feeling circle about it. That's and incredible. We get a summary from that clinical nurse coordinator saying, this was our feeling circle tonight. And it's amazing information that I would have had no idea of knowing anyway otherwise.
So one thing that I did want to ask you about is sometimes we hear that rounding can feel a bit canned because you're asking a similar set of questions, and staff sometimes perceive it, yeah, I'm being asked those questions because that's what leadership does.
Right.
Have you, in your experience, have you faced that, and what have you done to avoid that?
I think what you have to do is to keep it fresh, and you have to change the questions sometimes. You know, if you've addressed one issue, move on to the next one, and acknowledge that I have to ask you the same question again. Call it what it is.
Yeah.
If there's an elephant in the room, call it an elephant.
Yeah.
And so if folks are kind of questioning your motives, name what you're doing.
Yeah.
It's really important to me that I check in with you every day because I need to know how you're doing. And if you can frame it in the what's in it for them, I need to make sure that you have all of the things you need to do your job. I'm sorry if it feels awkward when I ask. I'd love to do it a different way. Do you have a suggestion? So being a little bit vulnerable, allowing them to say it, because yeah, it is awkward and canned sometimes. So letting them, call it that if that's what it is, and being like, I know, don't I sound like a robot sometimes? Receive that with a little bit of humor and grace, and that goes a long way for how they receive you the next time around.
Incredible. Well, Sarah, this has been a wonderful, wonderful conversation. We thank you so much for taking the time to come down here and chat with us. Well, ladies and gentlemen, thank you so much for joining us on this webinar today. I hope you found this conversation as entertaining and as informative as I did. If there are any questions, please feel free to add them in the question box, and Sarah and I will get back to you as soon as possible after the webinar. But thank you so much for your time today, and hope to see you at our next webinar.